On the call, we've also got Dr. Richard Pyle, Thrive Tribe's Medical Director. Give us a wave, Richard. Fantastic. And we've also got Tilly, our Marketing Manager, overseeing the chat as well. So we should all be able to see my screen now. So the plan for today's session is to give you an overview of who Thrive Tribe are. We'll then go into a chat with Richard around stopping smoking, and then I shall give some more details around, the service and reintroducing Smokefree Hampshire. As a brief introduction to Thrive Tribe, so Thrive Tribe is a leading provider of healthy lifestyle services. We've been in the industry for a good number of years now, and we've been very successful in procuring the new Smokefree Hampshire and Smokefree Ireland contracts. So Smokefree Hampshire has been on for a while now with a previous provider, and we're the new provider from today, April the 1st. And we're really excited to be taking that over. And over the last couple of years, we've got many award-winning programs, and we focus quite heavily on long-term habits and behaviour change. And to date, our services across the country have helped 114,000 people to successfully quit smoking, something we're really proud of. As I mentioned, the session today will last about half an hour, 40 minutes. In a second or two, I'll hand over to Dr. Richard Pyle to go through the costs of smoking. I'll then go into a bit more about our smoking cessation service. And then at the end, we'll have an optional Q&A if anyone wants to stay on the call with us. As you're all on mute, it makes the process a bit smoother, so there's no interruptions to the slides. If you have any questions, please do write them in the chat. Tilly will answer them as we're going through. If not, I can answer at the end. And is there anything that we can't answer on the call today, we will get back to you and we'll send the slides around to everybody with a list of Q&As and answers at the end. Okay. All right. Without further ado, Richard, over to you.
Thank you, Ben. Welcome, everyone. Welcome. Very much appreciate you joining us this lunchtime. It's a Tuesday, isn't it, today? Yeah, Tuesday lunchtime. If you're anything like me, and then you're probably just trying to desperately finish off your morning surgery. So it's good to see you all. And just to briefly introduce myself, my name is Richard Pyle. I am a GP. I work 3 days a week as a GP partner in Hertfordshire, and I do other bits and pieces throughout the week related to my other interests. I'm a certified practitioner in lifestyle medicine with the British Society of Lifestyle Medicine. I'm a cardiology deputy as well. And so obviously this is a topic which is quite dear to my heart. And I've tried to put something together today, which is hopefully a bit more than just 5 slides that repeatedly make the statement smoking is very bad for you, because obviously we all know that. But I think sometimes it is worth reminding ourselves just how bad for us it is and just how unfair it is, because actually, speaking as a lifestyle medicine practitioner as well, there's a lot of other stuff crowding the landscape at the moment, and yet we shouldn't forget that the significance of smoking. You won't have me for too long, thankfully, because what you're really here for is not to hear me waffle on, but to hear about the service and how to refer into it and to ask lots of questions of the Thrive Tribe team about it, which is very much their bag rather than mine. Could I have the next slide, please? Never get tired of asking for that. You're all muted, so I won't ask you anything. In fact, I tell you what, if you'd like to, in the chat, would you like to tell me who is this person in the foreground of the picture? Give us your best guess which historical figure this might be. I was most amused when given feedback after the commissioners had looked at these slides to be told that we wanted to avoid pictures of people smoking and cigarettes on slides, just in case anyone thought it was a good idea. I'm getting no feedback in the chat. This is Sir Walter Raleigh. Sir Walter, oh, in fact, no, maybe I am getting, here we go. Sir Walter, correct. Well done, Amanda. Valerie, I like that Shakespeare. I mean, it looks a bit Shakespearean, doesn't it? Very good. Yeah, so this is Sir Walter back from the colonies. I don't know if any of you ever heard the fantastically funny Bob Newhart sketch about Sir Walter Raleigh introducing tobacco to civilization. Hilarious, worth a listen. But this picture is quite famous because apparently the person in the background is his manservant, who, walking into the room, seeing Sir Walter, he thought, on fire, immediately threw water over him to put him out. Now, whether that's true or not, I don't know. But the fact is that smoking has been around with us for a very, very long time, and it has been making life shorter and more miserable since at least 1586, however much Sir Walter Raleigh appeared to be enjoying himself there. It is the original health hazard. People talk about what colours are cool in fashion. You know, people talk about black is the new black. Well, smoking is the new smoking. It's the original and the worst health hazard. Could we have the next slide, please? Any moment now. Yeah. So hopefully I'm going to keep you reasonably entertained because, of course, you've probably had your whole professional lives with people talking about how bad smoking is for you. And without ado, on to the next slide, please, Ben. So one of the things that I find really helpful when talking to patients, when teaching other health professionals about lifestyle medicine, etc., is to be able to compare things to other things in tables, which gives you an idea of how good or bad things are. And I'm often used to doing this with lifestyle medicine, talking about the benefits of being physically active and of losing weight and how much more powerful that is than taking cholesterol-lowering medications, etc. But smoking is the original and the worst, as I say. This table here demonstrates the behaviours on the left that are unhealthy, or the risk factors, should we say. And then with the subsequent columns, we've got the increased associated risk of cardiovascular disease, the risk of cancer, and the effect of life expectancy. And I put this all together with a variety of AI assistance, but also checking the links and references that it gave as well. And as you'll see, smoking in red here at the top is still the original bad boy. We've got a greatly increased risk of cardiovascular disease, of cancer, and a reduction in life expectancy, more substantial than any of these other things. Now, it's quite right that we talk about physical inactivity is the new smoking. Obesity is the new smoking. Loneliness, when I was lucky enough to give a TED talk on the subject, is the new smoking. And yet, of course, smoking is the new smoking. And all of these things undoubtedly impact upon our health. Some of them getting similar to that level, such as, for example, eating a very unhealthy diet, probably is the nearest other lifestyle risk factor that you could come to other than smoking itself. But just look at those headline figures: 2 to 4 times your risk of cardiovascular disease, accountable for 30%, responsible for 30% of cancer deaths, and reducing your life expectancy by 10 years. 10 years, it's a huge amount, isn't it? And of course, what's also really important, and those of us who are involved in patient care will definitely get this, particularly if you work in primary care or respiratory medicine. It isn't just about your life expectancy being reduced, because that's been going up for a while, although it's beginning to taper off now in the UK. It's about the years of it's your health span, not just your lifespan. And not only will you lead a shorter life, but you will lead a more miserable life as a result of the associated consequences. Right, the next slide, please. And of course, why do people smoke? Well, there are lots of reasons out there, and a lot of them are cultural and they're socio-economic. And it's very easy for someone like me, who's a middle-class professional, from a certain privileged background, as I have come from, basically, to make sweeping statements about how bad smoking is for you, and if only people could give up doing it. But the reality is that people don't take up smoking because they think it's going to make their lives better. But we do sometimes end up looking at why people perhaps stick with smoking, why they feel they couldn't manage without it. You also might find it amusing to hear that I originally entitled this slide "The Benefits of Smoking," which I didn't think anyone would take seriously, but apparently that wasn't obviously ironic enough. So we've got the false benefits of smoking. There are reasons why our patients, our clients, our friends and our families often still smoke, don't they? There is a common one about stress relief. People will say that they feel better for having a cigarette, and that's what they do when they're going through a particularly difficult time. And of course, you do get that short-lived, I wouldn't say well-being, but that short-lived perhaps level in stress that goes along with the chemicals that are released into your bloodstream as you inhale them. But the reality is actually that over time, if you look at it, smoking is associated with increased baseline stress, increased levels of anxiety. So just like all the other things that give you a short-term hit, like dopamine and sugar, this doesn't necessarily mean that it's something that we should be okay with. People do also sometimes say that they feel sharper when they've had their cigarette. As a non-smoker myself, I can't comment. But again, even if there were any brief-lived boost to cognitive function, the reality is that it is followed by withdrawal, it's followed by impaired focus. So there are no benefits, as you know, to smoking in any way at all. And we should think about it as if our bodies were a business. If you were a business, you wouldn't just make short-term decisions that got you a payoff today, but was ultimately going to result in bankruptcy. But in effect, that's what's happening to our bodies. We're making short-term decisions because of the addictive nature of cigarettes. I'm not judging people for the decisions they've made. You know, they've been almost had very little choice in their lives, and perhaps have seen people smoking all around them ever since they were little. But we do end up making these short-term decisions. And of course, it's a little bit like a business as well, in the respect that when you quit smoking, you do get instant returns, which are the financial savings, and then of course the growing profits year upon year upon year, the accruing profits of improved health and avoiding those health outcomes that you don't want. Could I have the next slide, please? And this is briefly, I promised, I think this is the last slide, talking about our body's recovery clock, because sometimes when you think about the benefits of stopping smoking, you might think, well, it'll be years till I noticed any benefits from stopping smoking. And to some extent, that's true. There are certain things that do take longer in terms of risk factors to improve and to get back to pre-smoking levels. But in reality, some of these benefits are quite quick. Your heart rate can come down and normalize within just 20 minutes of stopping smoking. Your oxygen levels can be measurably increased over a period of 8 hours, and carbon monoxide eliminated from the body within 24 hours. And within just 1 year, your risk of heart attack halves. And okay, the risk of other long-term conditions like lung cancer does take longer, but the benefit is felt from the immediate through to the longer term. One of my mentors, when I was doing my diploma, used to talk to patients about the stickiness of their blood, and describing the fact that every time they smoke a cigarette, even just for a few minutes, their blood is a bit more sticky, and therefore just temporarily increasing those risks of stroke and of heart attack. And of course, it goes in the opposite direction when we stop doing it. The next slide, please. And smoking is a social justice issue. And when I was an ICB lead for lifestyle medicine and health inequalities, we would talk about this. The fact is, it's not a level playing field, is it? It doesn't affect us all equally. If you look at the table here, for example, as a risk factor for people with poor mental health, as you would be unsurprised to see, it is both the case that it's a risk factor for mental health, and of course, more likely to be something that people with poor mental health engage in as well, because although we've discussed the myths being busted, it's something that they've known all their lives and feel sometimes helps them. And also, if we look at the smoking prevalence by socioeconomic groups across the country, you can see that it's not the well-to-do who are most troubled by this, but it's routine and manual workers, you know, groups of people who are often disadvantaged and vulnerable as well. And so it's just, again, worth emphasising that it's not just a physical health issue, it's a social justice issue as well. And in some areas like St Albans, where I come from, I think people are all relatively well off. Well, that's a generalisation. It's a relatively well off area. And it's felt that there are, you know, just a few tough nuts left to crack, but most of the smoking work has been done. In reality, there's always more work to be done. And I'm going to hand over to my colleagues now, who are going to talk to you a bit more about the service.
Brilliant. Thank you, Richard. So the next part of our presentation is to talk a little bit more about Smokefree Hampshire. So what we're actually offering the clients and how that's looking going forwards. Smokefree Hampshire is a smoking and vaping cessation offering. And that will be open to adults, children and young people, which we'll come on to in a few slides. And we'll also have a tailored specialist support service. Our adult offering comes in two parts, really. You can have a face-to-face service, and that's where you see an advisor face-to-face on a one-to-one basis. All our advisors are fully trained to NCSCT level 2, and you can see that advisor in a community centre, in a GP surgery, in pharmacies or in vape stores. Okay, there's also access to free quit aids at each session. So whether that be in a pharmacy, a GP, or whether it's with our advisors in the community, patches, e-cigarettes, vapes, and pharmacotherapy is on offer to all of our service users. So by pharmacotherapy, we mean things like varenicline, cytosine, and bupropion through a PGD arrangement. And everybody accessing these services, there's regular sessions, updates, and weekly check-ins. In comparison, the remote offering is very similar, but it's all done over telephone. So obviously Hampshire is quite a vast area. Not everyone wants or can access face-to-face provision, maybe a little more out in the sticks. So having face-to-face isn't always an option. So one-to-one telephone calls, can be really flexible. They can be done evenings, weekends, then around work shifts, and they have exactly the same benefits. We have free quit aids, as we mentioned before, pharmacotherapy, and instead of a face-to-face check-in every week, it can be a remote check-in on a weekly basis. Where can we access support? So as part of our face-to-face offering, we have face-to-face appointments in the community and in GP surgeries, and that's where one of our Smokefree Hampshire advisors can be based. And they'll all have their own stock of vapes and medication as well. We're working on a subcontract basis with pharmacies and vape stores. So we've got a good map of pharmacies already signed up, and then we're visiting the local pharmacy to speak to an advisor there who's also trained in stop smoking support, where they can have NRT medication, and that will include where a PGD has been previously agreed, varenicline and cytosine. And then we've also now started working with vape stores. So we've seen over the last few years, vapes have become more and more popular. So if someone wants to quit by using a vaping solution, we're going to support that. And we've got a few vape stores already signed up as part of our subcontractor agreement. Where are we currently located? So we go live from today, the 1st of April. We've already got a good number of locations up and running. That includes community centres, GP surgeries, and then we've got our vape stores and our pharmacies as well. I'll send these slides out afterwards. By all means, click on the Google Map link there. You can see what's currently provided. But if anybody would like to work with us, so for example, GP services, by offering support to our advisor, you can get off points. If you're a pharmacy or if you're a vape store that wants to get involved, again, please do get in touch. I can send over some service level agreements or some information on our tariffs. But yeah, have a look at the map, see where we're based, and yeah, we're always looking to expand that as the service develops. I mentioned earlier we have a service for children and young people. So this is looking for a smoke-free future. It's kind of what we're going for. It's designed for those under 18. And again, we've got updated and amended resources and tools to help under 18s quit smoking and hopefully quit for good. And these can be in person, they can be remote, or for this particular cohort, maybe a video call is more appropriate. And again, these are all with our fully trained NCSCT Level 2 stop smoking advisors. We have our specialist support. So this is where we have slightly higher trained advisors in many cases, and these are specialist programs looking at supporting those with severe mental illness, pregnant ladies, or those in the first 6 weeks after birth, and anyone that's at risk of having a relapse. And then to go alongside these specialist support, we're now also offering a cut down to stop program. So we're very aware that you might have patients that come through that smoke 60 a day, for example, or very high CO readings that it's probably not going to be possible to go completely quit within 12 weeks. But we're looking at reducing what they're smoking is still going to have quite a lot of health benefits. So we've got a cut down to stop program also available. In terms of, in addition to our stop smoking services, all our service users or patients, whether they come through GP, whether they come through pharmacies, vape stores, or they see our in-house advisor team, everyone will get access to our free digital program. And that is our app that has 12 weeks worth of videos and content to support someone on the quit journey. There's resources on there around, the benefits of quitting, what's around cravings, things like that. Loads of really informative videos that people can go through at their own leisure. We also have a free recipe book full of healthy recipes and ideas to get people cooking and eating a bit healthier, and a free online gym. So this is our Glow gym, and what that is, it's over 100 pre-recorded exercise classes, anything from low intensity for those that are quite sedentary, up into a bit more, high intensity, and even some strength and balance on there as well. So all that is free for anyone that accesses our Smokefree Hampshire service, and they'll also get a personal tracking tool and a free quick journal just to complete as they're going through their program. So what's new? So we've now got an increased support and awareness on nicotine reduction, and that'll kind of link into our cut down to stop program, particularly for harm reduction and their kind of associated benefits. We're doing more and more collaboration now with what's already existing in Hampshire. So that's where we get into the GP surgeries, the pharmacies, the vape stores. As I mentioned, we're trying to obviously increase that all the time. So if anyone's interested, please do get in touch. In terms of everyone on the call today, how to refer in, there are a few different ways that residents can be signposted towards us. The first one is your clinical operating system. So we've now got a nice button on EMIS, or your operating system. As of today, we've replaced the previous referral form, so there shouldn't be any confusion with having two forms on there. That should come straight through to us in terms of our patient triage. You can refer using our website as well. So go on our website, click sign up and complete on behalf of a service user. And we've also got a self-referral pathway as well. So, if someone sees some of our marketing, some of our leaflets, and they want to refer themselves, again, smokefreehampshire.co.uk, sign up, and they can self-refer themselves into our service. To be eligible, they have to live, work, study, or be registered with a GP in Hampshire. They have to be 12 years or older. So we mentioned that children and young people service, that's between 12 and 18. And anyone over 18 goes into our adult signposting service. And they also have to be a current user of a tobacco product or a nicotine product, which includes vapes as well. Working together. So as part of our contract, we are a universal offer of anyone that meets that criteria in Hampshire, but we are trying to target key priority groups. Those groups do include, where we know smoking prevalence is usually at its highest. So the 20 most deprived areas, those, as Richard mentioned, in routine or manual or long-term unemployed occupations, those living in social housing or experiencing homelessness. And then we're also going to target certain ethnic minority backgrounds where we know, again, that there's pockets around Hampshire that we can try and target and look at how we adapt our offering. And then we're also going to target the LGBTQ community to offer support. We've got our services for the specialists, so children, young people, aged 12 and above, those with severe mental illness, pregnant ladies, and then we're also going to try and support those that are experiencing drug or alcohol dependence. So this piece of work has already started. We've started looking at co-producing with a few of these kind of pockets across the county, and we'll continue to do so again as the contract develops. You'll probably see if you go on our website, we do offer training. So we offer VBA training. So this is very short training in smoking cessation, and it kind of gives you a bit of an overview about, tobacco use, the benefits of quitting, and how to have a really short conversation informing somebody or signposting them to access a quitting program like ours. We've then got brief advice training, which is a bit more in depth, and that is, again, how to have a conversation with a patient or a client service user about if they're currently smoking and they're not quite sure what the routes are next and the benefits. We can kind of offer training that how to have that conversation, and again hopefully get that signposted back towards a service such as ours. And then we're offering NCSCT Level 2 stop smoking training. So this is what anybody that's going to be delivering appointments to service users needs to be qualified in. This will be our mentors and our advisors. Anyone working in the pharmacies or the vape stores will also have this kind of training as a bare minimum. And that equips them fully to have that one-to-one appointment with a patient about quitting and the best avenue to do so. So what happens next? The service went live today, 1st of April, so please do start to refer into us. Anyone that's smoking your patients, get them into us, we'll get them at triage, and then we'll access, what's best for them. Is it vaping, pharmacies, one of our appointments with an advisor, or maybe an online service? We can have the conversation at triage and signpost them effectively. If you'd like to work with us, please do get in touch. So it could be your surgery, your organization, it could be your pharmacy or vape store. If you've not already had a conversation with me about it, please do reach out. I'll put my email address on in a couple of slides. If you've got any questions, please do get in touch. We'd love to hear from you. Hear your thoughts, hear your feedback. And we're really excited to be the provider as of today moving forwards. Hopefully already working with a lot of you. I can see a few names on the call, and if we're not working with you already, we'd like to do so further down the line. So get in touch. That's our number on there. That's our email address, hello@smokefreehampshire.org.uk. When I send the slides around, a few slides back, that is my NHS more secure email. And then, yeah, by all means, have a look at our website, and that's where you can signpost into us. Any questions? Please feel free to put them in the chat. Okay, right. Let's have a look. Sir Walter Raleigh, Shakespeare. Forest surgery at Borden. At the moment, I've not got a list of all of our surgery, but if you're a representative of that surgery, please do get in touch. And again, we can have a conversation around how we can work with individual surgeries. Please very kindly put a link to the map in there. Okay, so how quickly from referral will someone be seen or contacted? Okay, so at the moment, someone comes in, they'll be contacted within 24 hours. Now, that'll be from triage. That doesn't necessarily mean they'll be booked into an appointment advisor within 24 hours, but they'll be contacted straight away. And then depending on what avenue they want and where they want to be signposted to, that might take a bit longer, but 24 hours is our goal to contact anybody. Services around Borden, again, I'll share the map. If we've got any locations around there, we will more than happily start working with them. With the SLA for vape stores is a postcode range for who we can put through the same way as Smokefree Hampshire. Yeah, so whether it's a pharmacy, a GP surgery, or whether it's through a vape store, the same eligibility criteria applies. So for pharmacies and vape stores, we use farmer outcomes, and they have to have a postcode, a GP, or live, work, and study in Hampshire to be eligible. And then to be interested, they have to register in terms of vapes and pharmacies. For a GP, you can just signpost straight away through your clinic operating system. And if you're already signed up to us in terms of a GP, just keep on signposting to us, keep on referring. The referral form has just swapped over automatically today. If you're a pharmacy and you work with the previous provider, we will need to sign a new SLA and tariff system going forward. So again, reach out to me and I can do so. And then, yep, so anyone's got a vape store that wants to get in touch, again, reach out to me. I can pass over the new agreement. Can pharmacy sign up new patients directly? Yes, so they'll be using farmer outcomes. So, pharmacies and vape stores will see use farmer outcomes, and if they have a service user or a patient that comes in and wants to sign up directly, they can do so. Or, like I said, we can have as a triage, and if someone wants to get to the nearest vape store in their village, we can then signpost them to that location as well. I hope that's answered everybody's questions. Any more questions? Put them in the chat, or my email address is at the bottom of the page there, ben.middleton5@nhs.org.uk. Oh, I missed one. Can we offer NRT if someone wants to come off vapes? Yes. Yeah, that's deemed a route to help someone quit from smoking. Then NRT can be an option. We can offer NRT, we can offer vapor solutions or medication for anyone that meets our criteria. But it's up to the advisor to make a decision about what's most appropriate. Okay, well, that's like it for the questions. Thank you everyone for joining us. We will send a recording of this round to everyone